Hi everyone, my name is Lilith. I'm going to be presenting to you about Cushing syndrome today. So just to start it off, what is Cushing syndrome? So Cushing syndrome, aka Cushing's syndrome, or aka hypercortisolism, it's a disorder with physical and mental changes that result from having too much cortisol in the blood for a long period of time. So basically, to put in simpler terms, it's the overproduction of cortisol by the adrenal glands. Cortisol is a steroid hormone produced by the adrenal glands located right above the kidneys. So in normal amounts, cortisol helps the body keep the immune system in check, convert fat, carbs, and proteins into energy, respond to stress, modifies the body inflammation response to inflammation, maintains blood pressure and cardiovascular function. Ultimately, all the body systems are affected, but the main system affected is the endocrine system, which includes the pituitary gland, the thyroid gland, the parathyroid glands, the adrenal glands, the pancreas, and the ovaries in females and the testicles in males. So what causes Cushing syndrome? There's three main causes. There's an overuse of cortisol medication, there's an excess production of cortisol from a tumor in the adrenal gland or elsewhere, and there's a tumor in the pituitary gland. So the overuse of cortisol medication is seen in the treatment of chronic asthma or rheumatoid arthritis. And the tumor of the pituitary gland, it secretes the adrenocorticotropic hormone, or ACTH for short, which stimulates the overproduction of cortisol from the adrenal gland, which in turn is Cushing syndrome. So the underlying causes are pituitary adenomas, which are benign tumors of the pituitary gland that secrete increased amounts of ACTH, causing excessive cortisol production. There's the ectopic ACTH syndrome, which are benign or malignant tumors that arise outside the pituitary gland. So they say that over 50% of these cases are from lung tumors. Adrenal tumors, which are abnormalities of the adrenal gland, and familiar Cushing syndrome, which is usually Cushing's is not genetic, but some individuals may develop due to inheriting tendency to develop a tumor on the pituitary gland or more endocrine glands. Okay, so these are pretty much the clinical features of Cushing's. So if you see a patient that walks in with these characteristics, then they usually will have Cushing's. So here's a list of all the clinical features. This is why I mentioned earlier that pretty much all of the body systems are affected and not just the endocrine system. So the main ones that you see that are most prevalent is obesity or weight gain, the rounded or moon face, facial plethora or redness of the cheeks, menstrual irregularity in females, muscle weakness, hypertension, hyperglycemia, and then those stretch marks on the side. Let's see. Okay, so the complications of Cushing syndrome. Here's a list. So heart attack and stroke, infections, high blood pressure, blood clots in the legs and lungs, bone loss and fractures, unhealthy cholesterol levels, memory loss or trouble concentrating, depression or other mood changes, insulin resistance, and prediabetes or type 2 diabetes. Pituitary and, let's see, oops. Okay, so who it affects. So an estimated 10 to 15 million per million people are affected every year worldwide. The ages range between 20 to 50 years old, but it is seen that it is more prevalent in females, so 70% of the cases than males, so it's 3 times more than the males. And then pituitary adenomas are pretty much 70% of the cases in adults. And 60 to 70% in children and adolescents. And then people with type 2 diabetes, high blood pressure and blood glucose levels, and people that take glucose corticoids. Okay, so basically they just see if blood glucose that stays high over time along with high blood pressure, Cushing's might be the cause. So people that take the glucocorticoids can develop Cushing's. This type is known as exogenous. Roughly 10 million Americans actually take glucocorticoids each year, but it's unclear actually how many of them develop Cushing's. So how is it diagnosed? There's a couple different ways. There's a urine and blood test, saliva test, imaging test, petrosol sinus sampling, and the urine and various blood tests. It measures the hormone levels in the urine and blood test that tells if your body is producing excess cortisol. The saliva test in people with Cushing's, their levels of cortisol drop in the evening. So the doctors collect saliva to see at night to see if their cortisol levels are still high. Imaging tests, so CT scans or MRIs, are usually taken just to kind of check out the pituitary glands or the adrenal glands just to see if there's any abnormalities. And then the petrosal sinus sampling, so it's basically blood samples that are taken from the petrosal sinuses, which are veins that drain the pituitary gland to help determine whether the cause of the endogenous Cushing syndrome is rooted in the pituitary or somewhere else. So pretty much the treatment is, the main goal would be to lower the level of cortisol in your body. So reducing corticoid use, which is reducing the dosage of the drug slowly over a period of time, while still managing the asthma or arthritis or other condition. And the surgery, it's pretty much the most common. So surgically removing the tumor from the pituitary gland by going in through the nose. If the tumor is present on the adrenal glands, lungs, or pancreas, then the doctors will remove it with like standard procedure. If they do go that route, then they would have to take medication pretty much their whole entire life just to treat it. And then radiation therapy, it's used in conjunction with the operation if the whole tumor wasn't able to fully be removed. And medications, it's pretty much is used to control the excessive production of cortisol when surgery and radiation aren't, they pretty much don't work. And then the prognosis, it just varies. It varies depending on the cause of the disease. In most cases, it can be cured. Many individuals with Cushing's, they show significant improvements with treatment, although many find recovery complicated by various aspects of causative illnesses, but also some kinds of tumors may reoccur. Okay, so here's a video. Before I jump into the occupations of somebody with Cushing syndrome, here's a video of different ladies talking about how Cushing's has affected their lives and their occupations.
The Voices of Cushing's Disease, a 360-degree look at the condition. Part 2, Managing Cushing's Disease, a day in the life. Managing Cushing's disease requires understanding the day-to-day hurdles that come with the condition and the importance of support. Patients should monitor their cortisol levels to reduce the physical complications associated with Cushing's disease. In addition, they must learn to cope with serious psychosocial effects. Listen to the experiences of some people impacted by Cushing's disease and the adjustments they've had to make to cope in their daily lives.
On a day-to-day basis, for patients, a diagnosis of pituitary disorder, whether it's Cushing's, acromegaly, or any other condition, it affects everything in their day-to-day life. Some patients might not be able to work anymore, so they may feel guilty and that they can't work.
And depression is a part of Cushing's, right? And being fat all of a sudden causes even further body issues, which often leads to depression. So it's kind of, you're on an uphill battle that's really hard.
I lost a lot of self-esteem. I seem to have a lot of brain fog all the time, I know, and I also had anxiety, more than what I would normally have. I look back through the photographs, family photographs, and they're all of my husband with the kids because I hated being photographed. I suppose every person worries about relapse. I've seen people who haven't been cured, and I've heard of people that have had relapses many years later. So that's something always on your mind. I think within the first couple of years post-operatively, I recall having a couple of nightmares where the thing was back and I woke myself up with fright.
If you know some of the problems that you could face, you've got the medication there, you address it, and then you get on.
I have some adrenal insufficiency now, so I carry cortisone with me wherever I go, and I'm very decisive about activities that I might engage in, whether I can cope with those, my body can cope with those or not.
Voilà, donc en fait, je pense que la maladie de Cushing, pour l'instant, accompagne ma vie. J'espère que je n'aurai pas d'autres problèmes dans le futur avec cette maladie. Voilà, et puis mon rêve dans une vie idyllique, ça serait d'avoir un rythme du cortisol normal.
I would say that I wouldn't have asked this to happen to me. I wouldn't have. But in a kind of way, I'm really, this sounds really nuts, but I'm really glad this happened to me because I can deal with this.
Cushing's disease is a multidimensional condition with various elements to manage, including cortisol levels, physical changes, and the psychosocial impact. Regular and transparent communication.
Okay, so pretty much, that was just talking about how their occupations are ultimately, affected by Cushing's. So of course, the areas of occupation impacted. So ADLs, IADLs, rest and sleep, work, leisure, social participation. For ADLs, they were talking about depression, and then so if they're depressed, then they're not motivated to engage in showering, in feeding, possibly. And then functional mobility, because they do have muscle atrophy, it would be difficult for them to get around. Let's see. And for IADLs, of course, with all their symptoms, it would be hard for them to take care of others, take care of pets, to take care of their kids, driving, obviously, and then health management and maintenance, which they would need to, take medications on a daily basis. So they would have to get a good routine going for that. And then meal prep, cleanup, shopping, just finding clothes that would possibly fit them, or just even grocery shopping. Rest and sleep, so sleep participation. Some of them do report that they do have insomnia. And then work, like the video said earlier, that she was, depressed and unable to focus. So going back to work would be difficult for her. And then leisure and obviously social participation, it kind of goes back to the depression aspect as well. And, going out with friends, family. And the impacts of on occupational performance. So personal care and hygiene would usually educate them. Depression, so having them being in support groups, or have them do group activities. Memory loss or trouble concentrating, so again, that kind of goes back to them working, so possibly making notes or helping them make schedules. And then cardiovascular issues. So and also, if they have muscle atrophy or weakness or brittle bones, then obviously keeping the physical activity to a minimum. And then daily medication, so just medication management, helping them figure out what kind of medications and when to take them. And then kind of like a random fact, April 8th is actually Cushing Syndrome Awareness Day. So that's also coming up. And one thing that when I was looking up, information about Cushing's, I saw that a picture popped up and it was a dog. And I didn't realize that dogs actually could get Cushing's too, which was kind of interesting. So that was kind of a little tidbit fact. But yeah, and those are my references. Thank you.